Multiple sclerosis differs from the diseases previously discussed as it is not due to abnormal protein accumulation. About 1 in 1,000 of the population have multiple sclerosis, with women being more affected than men. Caucasians have the highest risk, with Asians and Africans having a much lower risk. This is sometimes described as people nearer the poles are more likely to get multiple sclerosis. Multiple sclerosis is a cell-mediated autoimmune disease. Repeated episodes of autoimmune inflammation of the white matter in the brain and spinal cord cause loss of myelin. Following this, multiple areas of scar tissue, sclerosis, form around the neurons. This slows or blocks transmission of signals to and from the brain and spinal cord. About 80% of people initially have relapsing or remitting MS, where the symptoms come and go, and periods of good health are followed by sudden relapses. In about half the people with relapsing remitting MS, it moves on to secondary progressive MS, where there are gradually more or worsening symptoms with fewer symptom-free periods. A minority of people have primary progressive MS, where the symptoms gradually develop and worsen over time without any periods of remittance. The characteristic feature of multiple sclerosis is demyelination. The pathological lesions begin as areas of inflammation with destruction of the oligodendrocytes, which are responsible for myelination in the CNS. Initially, patches appear as pink or later grey areas where the white matter should be. They're commonest around the white matter surrounding the ventricles and in the spinal cord. In this picture, you can see a radiologic image in a person with MS and a post-mortem brain. In the radiology, you will notice that there is an area of brightness within the white matter of the brain. It's the same as the grey matter of the cortex. In other words, this area has become demyelinated. In the photograph adjacent to it, you can see the ventricle surrounded by an irregular, slightly shrunken grey patch. This is an area of demyelination in the white matter. The changes are more easily seen with special stains. The blue stain on the left is called a Luxol fast blue stain, which stains myelin. You can see white patches within the blue. These are the areas of demyelination caused by multiple sclerosis. On the right is a photomicrograph. This is an active MS plaque, where we have chronic inflammation surrounding blood vessels, veins in the brain, and then there are foamy cells within the adjacent white matter, which are macrophages taking up the myelin which has been destroyed.